Okay, this is the first attempt to do this, and so this is about going to the States and doing a talk about promoting public prevention and my experience. And I don't think this will be the one I'll deliver, but this reflects on what happened when I first started work and I saw 15 children in a dental practice taking out teeth in just over 2 hours. And in the current situation, that's how much money I would have earned. Well, I don't remember earning that amount because that's the price of my first flat. Anyway, and yeah, so we always talk about antibiotic resistance, and this was the figures that have come from the government. And this is a different talk about basically saying, how much the cost has gone up. So I put a few arrows in here. This was the cost when seen in a hospital for a general anaesthetic. And after COVID, it more or less doubled. It's come down slightly. I don't know what it is now. But these are unnecessary treatments. So AAA, was there any follow-up afterwards, after COVID? Well, there wasn't because, quite frankly, maybe antibiotics, analgesics and advice is the best effect that and best way to treat dental extractions in children. I mean, has there been a follow-up? Has anyone asked the child? Yeah, I don't think so. So my talk was about this, so I'm going to make a joke about this. This is me in the States when I was a student, and clearly I'm not surrounded. It was an orthodontic study, but my main interest was travelling over the States, so I drove from Lexington to San Francisco to, Los Angeles, where there's a bit of a fire at the moment, and Greyhound, but I could only afford it by delivering cars. And this is the other end, I like travelling, and this was with my friends when I got stuck during COVID in India. And again, I was able to buy all the antibiotics for less than £2 for all of that. And if these are widely available worldwide, maybe we should have a little rethink on what antibiotics we can use. And yeah, so this came out last year, because it's now 2025. So dental disease is the most, what is it called, prevalent non-communicable disease. And we now know it's related to lots of other diseases. So what can we do about it? I like my TED Talks. So the best one's Ken Robinson, in that it's the most popular. But what he says is true. We go down a hierarchy of learning, and in the end you don't question what's going on. So none of this that I've put in here is really innovation, but Marianne Parisu talks about the mouth being the sentinel of the body, and we should promote this, and we should deal more with nutritionists and other people outside of dentistry. This Soda Politics I listen to on my bike. It's about 13 hours long. It's not a good listen, but what she does say is that we're all arguing about the war on sugar. So sugar is responsible for obesity, cancers, and a little bit of tooth decay. We should all be singing from the same hymn sheet. And this is why I was coming, is actually on this. This is what I used to do. The audio is treating gum disease in care homes.
So we applied the SDF, and probably a year in, I kept saying, oh my goodness, the plaque is not sticking anymore. Their gums aren't bleeding as much. And it was very interesting to hear Haley say that it does not allow the biofilm to adhere, because I've been saying this for a few years now.
So that was just on a webinar amongst a small group of hygienists and therapists in the States. This was another thing that I looked into, is why do we tax all these other things, but we don't tax our mobile phones? Well, mental health. Anyway, I don't think Meta will be too happy if we start charging people for tax on their mobile phones. And never mind Apple. I don't know why I put that in, but I'm the guy in the looks like I'm being abused. It's when I had hair. And anyway, so I made this 6 years ago, and it's starting to fall down. I tried it today for the BPE, and putting in the figures on the tooth map, it didn't work. But we should be promoting prevention. And what I do realise is, to promote prevention, we need to promote ourselves. So this is still active if you go to Teeth for Life on the App Store. It's now discontinued on Google Play. But this is the sort of thing that if we all share our knowledge, then we can benefit from. And yeah, so the government talk about promoting prevention. You know, you may have read this. I made a video. I don't think the video is going to run. And I made the video. Must be about 6 years ago. Yeah, so it's about 6 years ago. And the videos have kind of improved, not from me, but from the software that we use. And what I'm trying to ask about here is, how can we get a health hook? Do you think people will think, oh, you know, I'm less likely to have diabetes if my BPEs are low? Well, I'm not sure. The main one, it was the first one, which was, you know, have I got fresh breath? My light's gone off, which doesn't work. Anyway, and yeah, so these are other aspects. So what I've said here is tomorrow I'm going to Cardiff University to see about if we can create a bot whereby by talking to your phone, it'll give you the answers. And there won't be my answers on dental health. There'll be the government advice from, I can't remember the acronym, but basically it's delivering better oral health guidelines. And during COVID, the Scottish guidelines for acute pain were the best. So, and then I'll probably just make something up for treatments, because, you know, some treatments people are having are totally inappropriate. And so what we're trying to combat is creating a trustworthy resource for everybody, rather than people getting fake news or fake advice or poor advice on the internet. So the idea would be that people would go onto your website or your app where you actually talk about the advice that you would give, and in your voice people will trust it. So these are some of the other resources that I've made and updated more recently. Some are better than others because, quite frankly, you have to pay a lot more to have more features within them. And so some of the videos I have to put on a different website so you can embed them and download them without me muttering about them. So this was something that I'm just made from listening to Ian Chappell's talk. He's brilliant talking about perio. And basically what he's saying is that, and we're all aware of this, that nothing has really changed from when I qualified in 1982. The best thing for the public is to clean their teeth better with a brush. We still haven't got a vaccine, and one would never be approved anyway. But if we actually use dental nurses who are trained to give oral health advice, we'll get a far better result for perio disease. And that's far better for the public and far better for our NHS. So why don't we, promote it? So this is when he's trying to promote stuff. So if you go into YouTube, these are all about 5 minutes long. Whenever I apply for innovation within the health service, used to be AHSNs, all the health service people want is to know where I'm going to make a profit. And I think they've got it wrong, is that, the NHS, it's in the word, it's a service. It's not NHB, it's not the National Health Business. So we need to, if they're not going to do it, then we can do it. Oh yeah, and so I did start to make an app, but I knew I wasn't going to make any money. So I went down another route in order to fund the app. So this is still kind of dormant, but I can easily, with a little bit of money, do it again. And this was when I first started my app. So you can see the date there, 2017, when I thought about it, when I was still working. And what I didn't have is, to be honest, I've got a reasonable amount of expertise in prevention, but nobody knows me from Adam. And you need a third-party endorsement, which is what I wanted the NHS for. But they want me to show that it makes money before they'll engage with it. The whole thing's back to front. And yeah, so I said before about improving health. And the person that improved health the most, dental health the most, is this chap, Claude Hopkins. And he more or less invented the word film on the teeth. And that was the hook, is to remove the film on the teeth. And it was Pepsodent, the ring of confidence, before we even had fluoride. It was the brush that did the work, and that's still the case now. And yeah, I've done apps social media hasn't been very good. As you can see there, the most posts I ever got was falling off my bike. And recently I've done some of me skiing, and the best one is, it's got even more hits, is me asking my friends if they're interested in toothbrushing in a whiteout, and they'd much prefer to go skiing in a whiteout, risking life and limb, rather than me telling them how to clean their teeth properly. Yeah, so, and this is for the care homes. So I've got a website, careforteeth.org, made when my dad got ill. And we can just do so much more if we empower nurses. Right? And we can make it more cost effective for them to go into a care home rather than a dentist. And then the 3D dental printing, that's a no-brainer, just people need to do it. And this was really disappointing. So I went to this course, which is now, how long was that, 18 months ago. And while the presenter was concentrating on what we should do about nitrous oxide release, which, I haven't used in 30 years. I've seen it in use at Glastonbury, but not in the dental practice for a long time. And, but yeah, it's like 64% is the CO2 emissions. And I said, who's doing anything about that? Oh, yeah, it says 64%. And they said, well, we haven't got funding for that. Why don't you do it? Right? And so that's what teledentistry would be a huge help for. And that's why I'm going to the States, because I'm not going to learn much here. And this is equally disappointing. This is a brilliant course, but there are so few places on it. And the people are running it, I know in Yeovil, it's not good. And they're one of the 7. There's one that does it totally online. And you can do it online in the States. So I'm always on the phone sending emails to the GDC saying, can we do this? And I think it's called PACE or DACE in the States. So they can do the same thing in 3 months at a tenth of the cost of what is sort of charged here. The whole thing like this is a bit of a scam. It's a brilliant idea, but a government scam. They go around promoting it, but they don't fund it. It's and we're also guilty of that about not releasing our nurses to go on the course. But if you did an online course, as is the excellent Mouthcare Matters that's on Future Learn, we could do so much more. But yeah, there we are, teledentistry. That should be on my app. Well, it is on my app. It's just that no one looks at it, and it needs rebuilding. It's 6 years old. And yeah, so we have to look outside. And this is how, I can't remember which person this is now. I think it's How Innovation Works by Matt Ridley. And we need to look at different ways of how we can actually, and it's totally getting a bottom-up approach when it comes to health. The top-down, as we know, the hierarchy, the GDC, there are certain words that you could use for them, but pretty rubbish is one of them. And the others, there's more expletives. So this is, I'm not sure how many slides I put on this, but anyway, so this is how we should be part, and we should be central to delivering health. People come and see us regularly if they can. And I've made a load of videos for Doctors Reception with a company called NewMed. But, as always, who am I? But if you go onto YouTube and type in NewMed, I think I made them visible for everybody, but I may not have done. But go onto YouTube and type a few things. And that's what I'm looking into at the moment, is how the algorithm, I think it's called, for YouTube can really help people find relevant videos on my YouTube channel rather than elsewhere. So how you can get it locked in. I'm not quite sure if that can happen. Well, actually, I'm pretty sure it can't happen. But if people look at it from my website and from an app, then it would happen, I think. And so this is all about disruptive innovation. So this was the slides for, how I hope to get the app to work, to be, a dental health service app would be free at the point of contact for anyone using it. And, I'm not getting any money for it, but this is how it would work if I get it funded through 3D printing. And I've made a platform for that. I don't think I put it on here. Oh, yes, I did. That's where I am. So it's still, as you would say, in the beta phase. And to be honest, it's, I made a pitch for this that I showed to Health Innovation East. And actually, this could earn a fortune. If I wanted to make money, then I should just go around care homes scanning teeth, scanning dentures. I know I could earn a lot of money, but this is how nurses can earn a lot of money, and the therapists and hygienists. They just need to go into care homes with the scanner, but not just to make the money. They then need to support the oral health educators or oral health champions. Yeah, and again, I did this during COVID. We should be using the same sort of lean startup methods or agile to actually improve the message that we all give. So this was the idea, is for, I used to be a trainer for 20 years, how we can, a lot of the things that they do on the day release are quite frankly worrying and irrelevant, some scary, so that's why no one will have their own practice. And there's a great way we could make it what's it called? A franchise by setting up the details that were outlined by Steve Jobs before he made the App Store. And so if you go into his big white book, about page 300 in, it explains how we could start from scratch. We need to think different. We can develop from a barber shop, right? So let's start from scratch using the technology that we have, using the ability that we have, and we all have different abilities. So this is what I used to send to my patients, is I'd rather not send them. I would send them an email with their BPE on, and I made cards. And these cards are excellent because word of mouth is still the most prevalent way that people come to your practice. And the card, I'd indicate which teeth had pockets in. And at the bottom there, you can see the numbers. They were links that I just tried today and unfortunately don't work because they're linked to Vimeo, not YouTube. And I've stopped paying for my app, so I hope they're not listening because it will just, when they find out, they'll stop it. And but if you go into social media, I did this one, and this is about, I did some work that I should never have done, which is I replaced his front tooth with a Maryland bridge 35 years ago, and I met him out cycling, and it's still there. So, we don't need to be doing implants all the time. Oh, yeah, and of course, I used to do these on the health service, and I still did when I left. It's such a brilliant alternative to implant work, and they last longer. So it's only lasted 30 years. So these are the books that I look at. There's the big white book, was on Steve Jobs. Faster Cures. Yeah, the guy uses people before they get onto the hierarchical ladder who think outside the box. The lean startup's about computers. So the thing is, from someone who's probably intending to be a socialist and trying to support the NHS all the way through, I've gradually moved away from the NHS because it's all wrong. It's just too much admin. So these three books, I don't even know. I would imagine Julian Richards is sort of, he's given away his company to the people that work with him. And even this chap, Coke, or however you describe it, you can argue, even though he's the second richest person behind Musk, he has created wealth for himself, but also created jobs. And they all use this bottom up. They empower the people that work for them. If you ever go into, so Julian Richards, Richer Sounds, if you ever go into Richer Sounds, ask for a bit of advice. They're brilliant. It's because he's empowered them. So everyone's a winner. Yeah, and that's the word that they all use, trust. So this is what I've made so far. So I've got another website, dental-health-service.co.uk, which is my email address as well. But basically, I would have to pay someone to do that. So I had a little go at doing it myself, as I've done for quite a lot of these websites. And it's got the mobile version. The worry is that, if ever I was successful, the whole thing would collapse because too many people looking at it. I do not have that problem at the moment. But please look at it, and it looks best on your mobile. Oh, and this is when I first made my app. So this is what I did when I made my app 6 years ago. And it's a hobby. But you know what? This is a good hobby. It's trying to promote prevention. Yeah, and I've got lots of these presentations. The big problem is I missed the first lesson. So my filing, this is the equivalent of a very messy room. Only as with computers, it's extremely messy. Yeah, and these are the things that I would put in on any new app, but what you have to do is called product design. And I'm rubbish at product design because I keep showing people what they want, and they do, or rather what they need. Needs and wants. Anyway, the product design, I need help with that from someone who's not a dentist, because and this is just another thing. Actually, I think that was the person that helped me. So I've had, over the last 4 years, I've had some help since I've, as you would say, retired. There's product design, digital technology, all this kind of stuff. However, these brushes I really like. And so if you go onto my YouTube channel and type in triple bristle, it shows me doing a little bit of research, thinking this product will be rubbish. And now I'm just trying to promote it big time for care homes. but I use it myself. And these are the things that I've used to talk about them. But most of the last 4 years have been spent looking at other aspects of how we can improve health by how we can engage the public. So the top left was the first one that I did on how to make an e-health product, which was obviously an app. The interesting part was I surveyed my patients and asked them if they'd like to check themselves once a month for mouth cancer, and they all said no, they'd rather the dentist did it once a year, which, as we know, isn't enough. So these are more Rory Sutherland. Just go onto the BBC websites, and he's on it. What's it called? Developing the Unconscious, or something like that. And it's or buy the book, which obviously I did. But his views we should use, and they all talk about trust. And this one, this is the chap that I'm talking to at the moment. So I'm seeing him tomorrow in Cardiff. So he's, as it says there, he's with computer science, and this is what we're trying to do. And yeah, so we've applied for funding for this, and that was with LEAP funding as opposed to SBRI funding, as opposed to different funding. The person I'm most likely to get funding from at the moment is Alzheimer's and Society, and I'll know in about 4 months' time, and then be able to start in November. In the meantime, I'll try and do something else. And I did these. I made no one does scanning. It's not taught at dental schools. It's not, the 3D printing isn't taught at dental schools either. It's just a nonsense. These things have been done in the States for 13 years at Boston, since they took an impression. And 2017, I went to the States on Sirona World. So this is one of the things I've made. And they're talking about 3D printing. And there are my resources. And I think that might be the end. Well, let's see if that's worked.